Hello everyone, my name is Dan Lyus. I'm the Voscur VCSE advocacy rep for the Better Care Bristol Transformation Board. This is my first video. I've been to my first meeting. I became a rep in December. So I'm just going to let you know what happened very briefly at the meeting on the 13th of January of the Better Care Bristol Transformation Board. So it was in South Plaza. There was about 18 people in the room, mixed from the CCG, the acute hospitals, community services, and myself and Adam were there. Adam from Bristol Aging Better, and there were some NHS England representatives there looking at how better care is going in Bristol. So quite a packed agenda, 12-13 items. But I'm gonna condense them, give you a general view. But why was I there? Firstly, well, as the rep, I suppose I had this joint role. One is to help educate and give information to the group about the role that our sector could play in supporting them to deliver their aims, and the other is then to give messages back to the sector through things like this video about the meeting generally, that might give us hints and tips about how we could help in meeting the aims of Better Care Bristol. So the aims of Better Care Bristol, very simply I suppose you could put as improving the quality of care, helping with the integration of health and social care, but mainly around reducing the demand for hospital services, as well as speeding up the timely and safe discharge of people from hospitals. And quite a few of the items on the agenda got into this area. So there was statistics, there was program management reports on how the overall program of Better Care Bristol's going, and there were some updates and some detailed reviews of certain projects, and many projects make up Better Care Bristol, and there's some really good program management going on there about where each project is at and what its aims are, how it's delivering on its outcomes. There's clearly some thorough reviews going on. There's good questioning, I think, of is this project, that project, are they helping to meet and reduce demand on hospitals, or are they helping to speed up discharge, etc. Overall, it seems that, given the state of demand for hospital services around the country, that Bristol's not unique. There's a lot of pressure on Bristol, and so there's a lot of focus in this meeting on are we delivering. One of the interesting stats was that there'd been 3,333 more, I think, unplanned admissions than they had anticipated, than we were anticipating in this area. So it just gives a real feeling for why it's also important. So that then led into all of that review of how the project's going. There was a very specific item which was saying, well, what should the future of Better Care Bristol be? So I'm looking forward to hearing the outcome of that. There was going to be a meeting of a leadership team, so a few of the senior members of the board meeting separately to review progress. I think they were actually going to do that with the mayor, and Voscur were present, to look at how to take Better Care Bristol forward given the pressure. Should we continue to do what we're doing and just do more of it, or do we need to change any aspects? So hopefully hear about that at the next meeting, which is on the 23rd of March. So two specific things just to mention too. So there's a really good overview presentation from Mike Hennessy and his team about adult social care and what's changing there. It was a real information provision for the board, and Mike was talking about what's happening since the Care Act, the focus on prevention, the resource allocation system coming into adult social care, and he was giving lots of information to make everyone on the board aware of how the work in adult social care is dovetailing or needs to dovetail with the better care work and the work of the CCG more broadly, around helping with prevention, helping people to help themselves earlier. There's a lot about the triangle of care that you might have seen, or we can probably provide a link with this video. One of the other items that got a lot of discussion was about out of hospital care, how to divert people when they arrive at A&E from actually going into the hospital, even if they do need some quite intensive support. And there was a really good overview of what was tried and to be done in this area in recent years. And then there was an exploration of a project in other parts of the country which has used an enhanced service to go into people's homes that could run tests, medical tests within people's homes. I'm probably not doing that justice, but that was an interesting item, and nothing was decided in this meeting. I think that goes up to the Medicare Bristol Commissioning Board. So again, we'll hear about that on the 23rd of Feb. So I mean, I didn't contribute a great deal in this meeting. It was my first one. I was just kind of finding my feet. I'm hopeful to be able to give a few more messages in the next one, and to be able to give you more information after the next one. If you want to let me know anything, then please do. It's Dan Lyus, that's dan.lyus, Lyus is Lyus, at wecr.org.uk, or 07884003019 is my number. So you can get in touch if you're interested in Medicare Bristol and you're working in a space in the voluntary sector and you want me to help convey your views, or to get you certain feedback, if that's possible and appropriate. Okay, thanks very much, and I will see you again soon.